Hi, everyone, and thanks for joining our webinar today. My name is Sydney Berryman, and I'm a content marketer here at Revel. I'll be the organizer of today's webinar, and we're super excited to have you on the line. We have some great information lined up on how to review, revise, and improve your revenue cycle in 2020. But before we get started, just a few reminders. We will be recording the webinar, so the recording and the slides will be made available after the webinar. We also have set aside some time at the end for any questions. So moving on, I'd like to introduce your presenters today. We have Kim White, a client performance manager here at Revel. Kim has a strong background in all areas of revenue cycle management and various EHR systems. Kim's experience in the healthcare RCM field spans over a decade in all areas, including medical coding, billing, software configuration, and revenue cycle consulting. We also have Brandy Ashley, our client success manager at Revel. Brandy brings nearly 2 decades of revenue cycle management experience to Revel. Brandy provides an ongoing account oversight and consulting to Revel's hospital and healthcare system clients to ensure financial performance goals are met. Also presenting today is Adrian Schrimpf, a sales consultant here at Revel. Adrian sets short and long-term sales strategies and recommends product or service enhancements to improve client satisfaction and performance. With over a decade of EHR and RCM sales experience, Adrian is familiar with a variety of practice settings and specialties, as well as the modern-day challenges that healthcare organizations face. We're so thankful that both Kim and Brandy could join us today. They've really put together some great content that I think you will find very helpful if you're looking for ways to improve your revenue cycle in the new year. So a quick glance at our agenda today. First, Kim will cover the 6 common problems for lost or delayed revenue, and then dive into some of the questions you need to ask yourself in order to audit your current RCM process. Brandy will then wrap up the webinar with the KPIs you need to be reviewing this year to make sure you have a healthy revenue cycle. Again, a great agenda, and we're super excited to have you join us today, so let's get started. Adrian, I know that we have some people on the webinar today that might be wondering what we do and why we are presenting on the topic. Do you want to kick us off by speaking more to who we are and what we do here at Revel?
Absolutely, I sure do. And thanks, Sydney, for giving me the opportunity to kind of jump on here and be a part of today's webinar. And as Sydney mentioned, my name is Adrian, and over the years, I've worked with a lot of practices who have come to us struggling with revenue challenges, and it really can feel very overwhelming and sometimes difficult to even know where to begin. So I'm confident Kim and Brandy are really going to help us simplify things and learn how to begin tackling these challenges. And of course, if it becomes too overwhelming, that is why we are here. We are here to help you. And then real quick, before we turn things over to these lovely ladies, I want to take just a minute to tell you guys a little bit about what we do here at Revel. And though for some of you who have joined some of our previous webinars in the past, you might remember us by our former name, Group 1 Health Source. So after 25 years, it was time to refresh and rebrand. So we have officially kicked off 2020 with a new name, Revel. So we're still the same company, same ownership, same great teams. We just got a new name and fancy logos. So we're excited to kick off the year with a new name. So we know that healthcare has changed dramatically over the years, especially, and we really care about your success. And we want to give you our knowledge and experience to conquer the new age of healthcare reimbursement. So, although our name is new, we have a long-standing history of delivering full revenue cycle management and consulting services to private physician practices, hospital network physician groups. We work with practices of all sizes and specialties nationwide. And what we really feel like sets us apart is our experience working on eClinical Works, like many of you guys on the line today. So for well over a decade, Revel has also been a gold certified sales, training, US ECW support and implementation partner for eClinical Work. So we understand the software, like many of you, as kind of coming from an end user perspective, since we use the system each day to run our business. So if you guys find yourself wanting to optimize the use of the system, maybe you're struggling with workflow and kind of don't know where to start and kind of need some help accomplishing those challenges, or maybe you've transitioned to the latest and greatest upgraded software versions and you might need some help, or maybe you're struggling with MIPS reporting and tracking or revenue cycle management. Those are all areas that all of us here at Revel are equipped to help you navigate through some of those challenges. So we do take a team approach to our success. Revenue cycle management automation is meant to support our solutions, not replace it. So our clients, a little bit of how it works, our clients are assigned a client success team led by performance managers like Kim and Brandy. These team members are going to come with years of experience dealing with RCM challenges, and we're here to help serve the day-to-day needs of our customers. So you can also expect to work with folks like billing consultants, coding consultants, team leads, eClinical Work certified trainers, among other team members that will support the RCM process, which also is going to include certified coders and patient service representatives. So if you guys have any questions about how we help our clients increase their cash flow, we'd love the opportunity to talk with you. So I'm going to go ahead and Kim, I'm going to turn the floor over to you to kind of jump right in to start discussing some of the most common reasons for lost or delayed revenue.
Okay, great. Thanks, Adrienne, and thanks to all of our guests for joining. So though the items we're going to be talking about today are important throughout the entire year, they are also some of the most vital items to pay attention to at the beginning of the calendar year. So let's go ahead and jump in. The first item I'm going to cover is lack of verifying eligibility or completing pre-registration. So we all know that revenue cycle begins at the time the patient makes the appointment, which is why it's essential to have a pre-registration process that includes things such as eligibility verification, benefit review, and especially creating awareness of financial expectations at the appointment. Some of the common eligibility issues that we see practices struggling with are things such as entering incorrect patient demographic data like a last name, address, or gender. Also, just some simple keying error on the ID number or group number, or even changes in those ID numbers. So, just right in January 2020, we are seeing practices really struggling with the requirement of that Medicare ID number changing from previously being the Social Security number and alpha character to now that MBIN number. So even though those MBIN numbers have been active for a while now, that old format is no longer accepted, and we are seeing a lot of practices still trying to use the old number. Also, having the incorrect insurance selected in the patient's chart and then going out on the claim to the wrong carrier. So you may even have a plan, several United Healthcares listed in your system, but depending on that plan, maybe there's a different payer ID or claims mailing address if something would need to be dropped to paper that's entered in the system. We often see that as an area of struggle, which is causing claims to not get to the right location because of that incorrect eligibility selection. Often at the beginning of the year, we know that the front desk is more hectic than ever, with patients filling out paperwork and staff updating patients' charts, which makes it really easy to miss important steps in the verification process. By having a pre-registration process, you can eliminate a lot of that congestion at the front desk and let those users focus on verifying the information obtained with the patients versus rushing to input information from scratch. Pre-registration can also be obtained over the phone by sending out paperwork via the mail and having that sent back, or making it available to fill out and submit online through your website or patient portal if your system allows for that. The next item that I'm going to cover is lack of obtaining authorizations or referrals. So at the beginning of the year, we commonly see an increase in these issues for several reasons. One of them being patient insurance changes to existing patient insurance policies, or service level requirement changes from the payer. So if the staff previously didn't obtain an authorization for a service and or payer combination, nor are they aware of service policy changes, it can lead to a loss in revenue because that authorization wasn't obtained. If an existing patient previously didn't need an authorization for a repeated service, but now their insurance company has changed or that policy has just changed, we also see a loss in revenue still because they're not obtaining that authorization. They don't know that one is needed. Also, in regards to referrals, if that's missed because the staff is not aware that one is needed, that's still going to be lost payer revenue. So then you're left with having to bill the patient after the fact because they didn't make sure they had a referral, nor did the practice, or in the authorization from that perspective, many times the practices have to end up writing those charges off. So that's still going to be less revenue that you have for the services that you're rendering. We also have lack of collecting from patients at time of service. So again, we all know healthcare costs are increasing, which is leading to insurance companies transitioning more of the cost to the patient. Because many practices haven't been fully prepared for the transition, we're seeing practice collections overall decrease, patient AR is increasing, we see an increase in accounts being sent to collections, and overall a decrease in gross collection rate. An article from 2018 from Patient Engagement Healthcare IT, they reported an 11% increase in patient financial responsibility. And each year that percentage continues to increase. Oftentimes, this is leading to patients no longer seeking care, especially preventative medicine, because the costs are so high. This especially causes issues since in the industry today, clinically, we are moving more to a proactive focus versus reactive. Quality over quantity, and revenue is tied to that. Since the costs are increasing, it's more important than ever to ensure known patient responsibility is being collected at the time of service. So through proper eligibility and benefit verification, practices are able to identify copays as well as potential coinsurances, deductibles, and out-of-pocket expenses that may apply for that patient based on the type of service as well as non-covered services. This does require staff members to be prepared with the patient responsibility amounts and educating that patient of the financial expectations prior to being seen. Also, you can allow patients to be prepared at the time of service or work out a payment plan, preferably through a credit card or bank account on file system. The next topic I'm going to cover is still related to patient payments, but it's lack of having online patient payment options. So we live in a world where technology is thriving and people want quick and easy access. Many online payment options are quicker and less costly to pay through an online tool versus having to mail in a check, phone into a call center with long wait times often, as well as eliminating the sensitivity of mailing in credit card information. Personally, I've heard many friends and family members say if there's not an option to pay online, they don't have time for it or they forget about it, which leads to outstanding balances. Increased costly collection efforts trying to obtain the money owed, all of that resulting in a loss for the practice. Many EHR's patient portal systems allow for online payments, and many clearinghouses have partnered with vendors to allow for online patient payment collection. The easier it is for the patient to pay, the more likely your practice is to collect that revenue that is due to you. I'm also going to talk about charging under payers' allowables or incorrect allowables being applied. So this is often an issue at the beginning of the year as well when rates are being updated. Oftentimes we find as a revenue cycle management company that practices aren't aware of their payer contracts, agreed upon fee amounts, or maybe they have an awareness of what the details were at the time the contract was negotiated, but now there's eligibility for those payers to have, for those rates to be higher. So just as a quick example, a payer's not going to pay a service for more than the billed amount. Meaning if the payer allows $100 on a service and would normally pay that, but you only billed $80, the most they're going to pay now is $80. So this of course results in lost revenue, otherwise known as leaving money on the table. Another common problem we run into is contracted rates have changed, but the payer isn't processing correctly with the correct allowable amounts, and a practice isn't aware. Per AMA statistics, a claim that is underpaid is up to 35% under the original contracted amount. So if the practice isn't aware that it's happened, obviously this is going to result in lost revenue. Or if they are aware and have to file an appeal, it's still going to be delayed revenue, but now you also have resource costs with that. So last but not least on this topic regarding the common reasons for lost or delayed revenue is providing new services without knowledge of reimbursement rates and requirements. So we often find denials being received for new services a practice is performing. However, they didn't know what the requirements were in order to get that service paid. Or practices start performing new services with the assumption that their revenue is going to increase by a certain amount, only to find that the reimbursement is actually lower than what they expected. So it's very important prior to rendering new services that you know the reimbursement rates along with what the requirements are to receive that reimbursement. So now that we've covered a few of the common issues for lost or delayed revenue at the beginning of the year, we will now talk about how to identify if your practice may be falling short in some of these areas. So how to start auditing your RCM process. The first question I would ask is, do you know what your overall denial rate is along with your top 5 denials? So it's vital for practices to know this information so they can determine how to prevent or eliminate as many as possible. As a revenue cycle management company, the most common ones we see are related to things such as eligibility, authorizations, medical necessity, just to name a few. But if you know what areas you're most struggling in, you can then start to identify why the struggles are present and how you can reduce or eliminate them. The next question that I would ask is, do you verify eligibility on every insured patient prior to services being rendered? So majority of EHR and PM systems have the capability to verify eligibility within the application through integration with their chosen clearinghouse. So there's thousands of payers who allow for electronic verification through a clearinghouse connection, but for those who don't, you can still use payer websites and IVR phone systems as an option. The electronic verification within an EHR PM platform can be checked per patient and appointment, but many of them do have scheduled job functionality that can send batch requests along with batch responses. If your system allows for this, it's important to make sure you're utilizing that feature. Specifically, if you are utilizing eClinicalWorks, the eligibility info comparison data available on the appointment screen, that will show what the insurance has for some of the demographic data versus what you have in the system. This can help reduce or eliminate rejections and denials for some of those incorrect data points. As an example, if the comparison report shows the insurance has a different last name, or maybe the spelling's a little different, the gender may be incorrect, or even date of birth, you can notify that patient who can contact the payer to make the necessary updates before the claim is even filed. Of course, that would be if you have it correct in the system, but you see the insurance has it incorrect. The next question, do you know when that authorization or referral is needed? So this information can often be obtained through proper eligibility and benefit verification, but it's important to be knowledgeable of common payer requirements. Many payers provide those authorization and referral requirements in their policy bulletins at that service level, or CPT, as well as they publish any changes in their monthly or quarterly updates that they put out. In addition to knowing that an authorization or referral is needed and obtaining it, it's equally important to ensure the information is submitted on the claim. Oftentimes here at Revel, we've received a denial for no authorization or referral, only to later find out the practice did obtain that required information, but it wasn't notified to our billing team correctly through the system, therefore the claim was filed without it. This leads to delayed revenue, as well as now cost of resources having to backtrack for something that could have been prevented prior to claim submission. The next question I'm going to cover in regards to auditing your RCM process is, do you know how many copays aren't being collected up front or at the time of service? And do you have a self-pay fee schedule? So in order to know if your time of service collections are good, you need to know what your expected collections are versus what you're collecting. Many EHR and PM platforms have reporting capabilities based on specific data points that will allow you to see expected versus collected. If you're using eClinicalWorks, you can use a copay configuration with associated payment types that will help you see in a report what the expected copays to be collected were versus what was actually collected. This helps identify what you're missing and where you can make improvements. It's essential for front desk staff to be confident and comfortable asking patients for money, or else your patient collections will suffer. And that is really hard in the industry today because so much responsibility is falling on those patients. Also, in regards to the self-pay fee schedule, it's important to make sure that rates are set for services performed and that your front desk know what those self-pay rates are. It's also important to make sure that they're comfortable and fully aware of the self-pay policy guidelines. Many times we find revenue is delayed or lost because self-pay patients are seen without proper collections while the patient is in the office. Often this is because the rates aren't known, patients may leave before checkout, or a standard upfront self-pay collection fee hasn't been set. The next question, do you know what your payer's contracted allowable rates are, or do you have any payers returning allowables equivalent to the billed charge? So if you do have different contracts, many EHR and PM platforms allow you to have different fee schedules that can be set by insurance, facility, provider, but within an electronic fee schedule, if you have your allowable or contracted rate built in, you can then run reports of the fee schedule allowable versus the posted allowable. This will help show any underpayments that you're currently receiving. Also, if you monitor reports that show your billed charge versus the posted allowed amount, you can identify claims being processed by the payers with the allowed as equivalent to the billed charge. This will help show any opportunities for billed rates that may need to be increased and reduce money being left on the table. So the last question that I'm going to address regarding where to start auditing your RCM process is, are you providing services that you're not being reimbursed for? So if you are rendering services you're not getting paid for, it's important to know that along with why you're not receiving that reimbursement. You need to determine if there's things you're missing and need to do in order to get reimbursed, or if the services just can't be reimbursed at all, whether that's by payer or across the board. It may still be necessary, of course, to render the service to the patient, but if you know it's not going to be covered, you can be prepared ahead of time for that patient to be billed if that's appropriate. And now I'm going to hand it over to Brandy Ashley, our Client Success Manager, to address some supporting KPIs for these topics.
Great. Thank you, Kim. Those are all some great areas for us to begin auditing our processes. And what you'll see in these KPIs is they're going to mirror very closely to what Kim has shared with us. But here is where we talk about how do we pull those into an actual report? How do we actually start digging in and understanding the different areas? She spoke a lot about denial reporting, and this is one of the top areas that is important to focus on because this will give you a definite insight into lost revenue opportunities. What I encourage you to look for are those avoidable front-end denials. What are those things that are happening in the front end when that patient is in the clinic that is leading to denials downstream? Those are the areas such as eligibility, authorizations and referrals, the misinformation between what is going out on the claim versus what the payer has, all those areas that Kim recommended for auditing. You'll be able to find those in your denial reporting. Many EMR systems and EHR systems have denial reporting built in. There are also other great tools that we use here at Revel to pull that denial information that helps us to further analyze and identify where our problems are so that we can start tackling them head on. In addition to denial reporting, we have talked a lot today about time of service collections. One of the biggest areas, as Kim mentioned, that we miss out on revenue is with our patients. When we're not collecting at the time of service, that collection attempt on the back end is much more difficult. As she mentioned, pulling reports, looking at data, looking at your actual versus your expected are very important places to start. She did mention how some of our systems have functionality built in that will help pull that detail through. But I encourage you, even if you're a new practice, you're new to the system that you're working on, you may be new to managing a practice, even starting with an Excel spreadsheet is a great place to start. I know from personal experience that's how I started whenever I was in that position. It gives you some insight into what's truly happening there at that front end. It helps you identify your team's strengths and weaknesses when it comes to talking with the patients and explaining their financial responsibility. In addition to monitoring what's actually happening at time of service, it's important to look at your patient AR. You want to understand how much of that AR is going back out to the patient. How much are you having to bill them on the back end? By looking at this, you can get a better understanding of where you're missing out on opportunities. I know a lot of times it's easier to focus on collecting copays. Those are often more straightforward, easy for the clinic staff to understand, to know what to collect. But we're seeing more and more where insurance payers are going to deductibles, to co-insurance. It's not the straightforward copay like it used to be. By monitoring your patient AR, you can identify those opportunities. You can see what's typically falling to those deductibles. What does that reimbursement look like? How can you help set standards and guidelines for your staff so that they know what to collect? This is a great opportunity for even creating cheat sheets. You can, when you start digging into that AR, it helps you identify which payers you need to start collecting more on up front. That's great information that you can provide to your staff. So understanding where that AR is going, understanding how much of it has to go to bad debt. How often are you writing things off because you're not getting payment after 3, 4, 5 months? How much are you sending to the collection agency? Any of you that have ever worked with a collection agency knows that they will take a percentage of that revenue. And so if you're not collecting it, not only are you potentially losing all that patient revenue, but if they collect it, you're losing a portion of it. So how much can you do on that front end? The next area talks a little bit more about monitoring your fee schedules. Kim did a great job of explaining the importance of looking at how much you're getting reimbursed versus how much you're billing out. One of the reports that we monitor here at Revel closely is a CPT paid in full report, where we look for just those trends. Where do we see areas that we're getting reimbursed at 100%? Is that an area of opportunity for us? Not only do you want to look at that with your payers, but in addition to the CPT paid in full, you want to look at what you're setting your self-pay rates at. She talked about self-pay fee schedules as well, and it's always important to make sure that those fee schedules are set to where you're getting reimbursed at a higher than Medicare rate, which is very important, but you're making up for the cost of the services that are being provided. So paying close attention to what you're actually charging out is very, very important. The next two topics talk a little bit about just high level of taking a look at your collection. And your gross collection ratio is actually looking at your payments over your charges. This is just without taking into consideration any adjustments, how much are you getting paid versus how much you're sending out in charges. If you know what your payer mix is made up of, this is a great ratio, a great formula to look at. If you're in an area that has very high government payer, you're high Medicare, high Medicaid, then you're going to see this number is lower. It's in the 35% mark, which is about average. And so knowing that is important. If you are in a very high commercial area, you see a lot of those United Healthcare, Cigna, Aetna, those higher paying commercial plans, then when you do this simple calculation, you want to see that percentage higher. We've seen those percentages range anywhere from 45 to 50%, depending on your contracts. Even I've seen it even as much as 60%. So it's a great way to judge, are your payments coming in compared to what you're billing out and who you're billing these to. The next one is your net collection ratio. So the difference here is you do take into consideration those adjustments that come through. This is a percentage that you want to see as close to 100% as possible. Once you take in any of those adjustments, those contractual adjustments that come through, it should net out to where the percentage left is what's sitting still on the table. And a lot of times that's where you'll see your patient AR sitting as well. So if you look at your payments and then as compared to your charges minus your adjustments, if you are averaging around 95%, that's a great percentage. What that tells me is we've got about 5% of our revenue that's hanging out there, and we need to figure out where that's at. If you're pushing closer to 100%, then that's a fantastic rate. If you're dropping way below, then that means we're not getting claims paid, we're not getting patient AR recovered, and so that's a great tool as well. That's one of those, like I said, you want to reach for that 100% mark. And the last thing that you want to measure and take a look at has to do with your practice. Your practice volumes. Are you utilizing your schedule? With your provider time, are you using it to the max available, making sure those schedules are full? Are they being productive during those times? These are even taking into consideration no-shows, cancellations, reschedules. Are you tracking those, and are you trying to recover those patients? Some areas to look into as well is your chronic care management. For those of you that have chronic care patients, are you utilizing tools? Are you measuring the times that they come in, making sure they're meeting their minimum requirements for when they need to be seen by the provider? Are they following up with their treatment plans? There's some great tools out there that we work with as well in regards to chronic care management that really help to increase the productivity and to make sure that you're able to bill out and the max volume for your patients. And then you want to consider your procedure mix. Depending on the type of service you provide, are there opportunities to build in that service line? Looking at other similar practices is always a great tool. We like to compare across service lines to see, what services are beneficial, what are bringing in good revenue, what are the patients needing? Is there something out there that you could provide to your patients that you're not? And it's always a great tool to look at and to make sure you're following up with those as well. And one of the big things that you'll see is maintaining and building a healthy revenue cycle really starts at the very beginning. It starts from that very first phone call with the patient, and it builds from there. And so in order to move on and to maximize, you want to make sure you have a very good grasp on that front end of your practice. We also have some other great tools that we use here at Revel, and I know that Adrian was going to jump back in and share a little bit about those. Adrian, would you like to share some information with us?
Sure. Yeah. And thanks, Brandy and Kim. Very, very good information. And as Brandy mentioned, analytics are so important to understanding the financial health of the practice. And it's another one of those things that really can be difficult to manage. And I will tell you from my perspective on the sales side, probably one of the top three frustrations I hear from most organizations that I work with is they're just very frustrated with they're unable to produce the analytics they need, or it's really tough to pull them. So if you are looking to make better business decisions faster, Revel's enterprise analytics platforms makes it really easy to create custom dashboards and set alerts that you can move quickly to correct any revenue cycle issues before they escalate to big issues. We make it really easy to report per physician and slice by provider and CPT, flagging underpayments and overpayments, which Kim touched on today, to ensure accurate claim payment. In fact, we will fully automate those monthly productivity reports and tie the results to goals and benchmarks. And in many cases, it really doesn't matter what PM system that you're on, we are able to produce these analytics. So if you have some questions, or if you're one of those who really are frustrated with reporting, those are areas that we can also help with our enterprise dashboard tools. So yeah, let us know if you guys need some help with those things. So Sid, I'm going to go ahead and turn things back to you to conclude our webinar today.
Okay, great. Thank you, Adrian, Brandy, and Kim. That was a lot of really great information to take in. So if you happen to miss anything, don't worry. We'll be sending you out an email later today with the slides and the recording. So now that we've reached the end of the webinar, we're going to take any questions that you might have at this time. So if you do have a question, type it into the chat panel on your screen and we will get to those. As we wait for those questions to roll in, I want to make sure that you know how to get in touch with us if you'd like to learn more about our eClinicalWorks implementation, optimization and training services, or our revenue cycle management services here at Revel. Following the webinar, you will get an email with a short survey. You can let us know how we did, recommend other webinar topics, or request for one of us to get in touch with you. You can also simply reply to one of our follow-up emails and our team will be quick to get back in touch with you to see how we can help. So we'll just wait for a second to have any questions pop in. Okay, so it looks like we have a couple coming in. So the first question is, do you have recommendations of other key areas to audit at the beginning of the year?
Yeah, so this is Kim, I can answer that question. Yeah, I would definitely say my next points would be making sure that you have a charge reconciliation process, and also that you're monitoring the date of service to claim date as far as when your charges are being created, and even claim date to submission date. You know, obviously with charge reconciliation, that's important because you want to make sure all of the services that you're rendering, that those are being created into charges and those are getting billed out appropriately, whether that's to insurance companies or to patients as well. And then as far as an important reason, I think, to make sure that you're monitoring that date of service to claim date and claim date to submission date, depending on what software you're on, the verbiage might be a little different. So just kind of to break that down, if you're not on eClinicalWorks, would be claim date is just, could be transaction date in your system possibly. It's just when that charge actually got created. Obviously the date of service being when that service was rendered. And then submission date separate from that claim date. So obviously, you have that date that the charge was created. Most of the time you're going to get that out the same day, but sometimes you may need to hold that for certain reasons. And so that's why we look at monitoring that submission date. But regardless of when that date of service was or when that charge was created, if that's, if it's not created or it's created and being held for some reason, that's just delayed revenue then. And you really want to watch that and be aware as well of what your payer's timely filing limits are. So every payer varies. You may have Medicare at 365, United Healthcare at 90, Anthem and Aetna having different dates. So just making sure that you're monitoring that. I know we sometimes see with practices where they're pretty aware of what those dates are. And so if they get behind on their charting, they get that charge in, but it might be within just a couple days of timely filing. And the issue with that is if that charge has to be held for some reason, or if, you know, a really bad, like in a bad case scenario, the clearinghouse has an issue and then that claim doesn't get submitted to the payer on time. Sometimes we see it might just be a day or two over. So making sure that you're closely monitoring that, making sure you have all your charges and keeping those timely filing requirements in mind is really important.
Okay, great. I know we have another question in here. So if I don't know what my contracted rates are, how can I get that information?
Yeah, so I can answer that one as well, just because that topic I talked about a lot in the process. So we do get that question a lot, you know, and it varies. Obviously, in some of your larger groups, they have those relationships closely with those provider reps, credentialing departments, and things of that nature. But a lot of times with the smaller practices, it's been a long time since they've had those conversations, or maybe someone had those conversations for them years ago, and that person's no longer there, and they don't know, you know, who to outreach to. So commonly, you know, obviously your provider representative that you have. I know some payers are kind of getting away from that, and you know, when you have an issue, you kind of go into a pool of people, and you know, someone will reach out to you when they can. But if you don't have a provider rep, or if you don't know who your provider rep is, if you contact provider relations or the network management department, you know, sometimes payers might call it something different, but if you contact them and just say, you know, what you're looking for, that you're a provider or with a group practice, and you need to get a hold of your contract and to know what your contracted rates are, they can help get you to the right person or the right department to help you.
Great. That all sounds good. It looks like that's all the questions that we have today, so I'm going to go ahead and wrap up the webinar. But remember, if you have a quick minute, be sure to complete the short survey after exiting the webinar. Thanks again for taking the time to join us for this hour on how to review, revise, and improve your RCM, and we hope that you all have a great rest of your day.